David Mukura, very strong words from him a moment ago, saying that the pandemic in his province is out of control. He was welcoming medics from the South African National Defence Force. Ziyanda Ngcobo is with us, our senior political reporter. She joins us now. Ziyanda, good afternoon to you. Very strong words from the Premier this afternoon.
Absolutely, Stephen, and if you put this situation into perspective, the Premier says that we have well surpassed the peak of the daily infection rate of the second wave. He said during the second wave, our daily infection rate was at around 6,900. He says we've already surpassed that number by 2,000, and we haven't even reached the climax of the daily infection rate in this particular province. The Premier saying that the Provincial Command Council will be meeting tomorrow, and they won't rule out the possibility of going to the National Coronavirus Command Council to request tighter restrictions. This comes after the Premier said that as it stands, with us being currently under alert level 3, they have not yet felt the impact, and the Premier really is saying that he cannot stand and address the people of Gauteng and say that the situation is normal. However, driving through the streets, both in the suburbs and in the townships, he sees that the citizens of this province seem to have this false sense of security and belief that all is well. He said the restaurants were filled to the brim, the malls were also packed to capacity, and really strongly urging the citizens of this province to try and stay at home as much as possible, even saying that those who've been vaccinated, most of whom have only received 1 dose, should not also think that they're out of the woods, because this situation is dire, and beds, Stephen, the most important thing, are fast running out both in the public and the private sector.
I mean, a very bleak picture being painted. Is he expecting the military personnel to make a big impact?
Certainly, the Premier saying that this province needs as much help as they can get, and the military personnel, an average of 60 people will be deployed to this particular facility, if my understanding was correct, and they'll be doing several things: occupational health, but also helping to relieve the personnel at COVID-19 facilities, who, of course, we know some staffers also get infected. He says that they will also be seeking more assistance from national in terms of being able to bolster efforts. You recall, Stephen, that the Charlotte Maxeke Hospital is currently not operational, and we asked questions around whether or not this is also not adding on to an already pressurized system, and the Premier saying that if it were up to him, Charlotte Maxeke would be open as of today, given the fact that there are beds at that particular hospital, over 400 beds that were dedicated to dealing with the COVID-19 pandemic, and this is even excluding the ICU beds, Stephen, and they're currently not operational. What we do understand is that the staff from Charlotte Maxeke have been deployed to other health facilities where they're also, they basically followed their patients, and they're bolstering efforts at other health facilities. But really, the Premier saying that he can't rule out that we'll go back then to that Newzroom facility situation where people now have to be taken to that field hospital in order to relieve the pressure on the system. He says just with the numbers over the last 5 days, he says we'll only see the impact in the next 7 days in terms of the number of beds that are available, because he says while the issue of personnel is being dealt with, ultimately it's going to boil down to the beds, and that will of course then have an impact on the death rate in this particular province.
Ziyanda Ngcobo, thanks very much indeed. Our senior political reporter live with the Premier of Gauteng this afternoon. Very strong words.